Welcome to our Ask the Expert series for adults living with hydrocephalus and normal pressure hydrocephalus. I am here today at Johns Hopkins Hospital with Dr. Mark Luciano, a neurosurgeon, and Dr. Abhay Moghekar, a neurologist, with the Cerebral Fluid Center for CSF Disorders, and with my coworker, Jennifer Bouchard, the education manager at the Hydrocephalus Association. So this is a fun question because I have many friends who are in this situation, but I want to say the question. Can someone with hydrocephalus have children?
This is a great question because it has a simple and happy answer. Yes, you can have children, and many of our patients with hydrocephalus do have multiple children. To go in a bit more detail, if you have hydrocephalus and have a shunt, for example, during pregnancy, especially in the third trimester, there may be changes in pressure and there may be some symptoms of headaches. Working with your neurosurgeon, most always those can be managed medically or sometimes occasionally with a tap in various ways to get you through some increase occasionally with headaches. That does happen. Shunt failure can happen at any time, as we know, sometimes unpredictably. Most of the time we can deal with that, especially if it's a non-obstructive or a distal obstruction. We could deal with that in a delayed fashion after the delivery. So yes, you can have children. There may be some symptom changes during pregnancy that can be easily dealt with. In terms of delivery, it really is between the obstetrician and the patient as to what kind of delivery, whether it be a natural vaginal delivery or cesarean. It really is what he feels is best for mom and the child. The only exception is in that rare situation where there is increased intracranial pressure and there's a shunt failure right then usually a general anesthesia is preferred and a cesarean section. That's a very rare event. Most always, the situation is one where whatever the obstetrician prefers in terms of delivery is fine. What I recommend is that anybody planning to get pregnant or essentially initially pregnant, go see their neurosurgeon. Let him know that this is happening, that there may be issues in a few months. He'll advise you as to what he would do. It's also good for him to know when you are delivering so that he's available, just in case the catheter might have to be adjusted. Again, it's not a very frequent issue, but it's good for him to know that this is coming up.
So does a woman with hydrocephalus who is pregnant need to be with a high-risk OBGYN?
Generally speaking, the obstetricians believe that's the case, that they should be. And so if it could be arranged at a facility where their neurosurgeon is or a neurosurgeon who can be there on standby only would be helpful. But generally it is considered high risk.
Okay. And also, during delivery, is there an increased need to have doctors there for the baby? So neonatologist or? It's
a general, whatever the obstetrician at that point feels is required for the delivery.
So the two primary team members then of this medical team would be a high-risk obstetrician and a neurosurgeon, helping to guide the decision-making around the pregnancy and the delivery.
Mm-hmm. And the neurosurgeon would be there, for example, if there are issues of higher pressure. One advantage of current practice in hydrocephalus is many people do have adjustable shunts, for example. And it's not uncommon in my practice to sometimes dial down the resistance of the shunt in the third trimester, because in the third trimester there's a lot of pressure in the belly and the flow slows down. And so we try and compensate by increasing the flow. And then after delivery, often we turn it back up. So it's a nice feature of having that adjustability, and it can help women get through any mild headaches that they might have.
So this might be a hard question, maybe a question that you don't want me to ask right now, but when you were talking, it made me think of it, and I can't imagine that some of our viewers didn't think of it as well. If you do go into shunt failure while you're pregnant and you need to have a surgical intervention for your shunt, can you?
Well, yes, we can do. I mean, you can have anesthesia, general anesthesia during pregnancy. So we can, if we ever needed to change a catheter or a valve, we can do it, and I have done it very rarely, less than a handful of times.
But best case scenario is to try and manage any issues before the delivery.
And on occasion, that might mean, if a person truly does have, for example, a distal blockage, and it is a problem, that might mean some drainage from the reservoir above during the third trimester. Sometimes medication is possible, but we try to stay away from that as well.
Great. Well, I love happy questions like this, and I think Jen and I would love to give a shout out to all of our hydro moms out there that we know and love who have come to conference and shared their experiences of living through pregnancy and childbirth with hydrocephalus and joyfully welcoming a new baby into the world. And as always, we do have our Hydrocephalus Connect program, which is our peer support volunteer program. So if you are thinking of getting pregnant or are pregnant and you'd like to speak to somebody who also has hydrocephalus and is a mom already, has already had children, please give us a call at the Hydrocephalus Association. We would love to connect you with somebody who is also walking on your path. Jen, do you have any other things that you'd like to mention?
No, just like Amanda said, is we have a wonderful community that we can connect you with, and they can share their experiences.
Yep. So thank you, everyone, for joining us, and we will see you guys next time at our next Ask the Expert series, which you can find on our YouTube channel. And thank you for those of you that submitted questions through Facebook and Twitter to make our Ask the Expert series so robust. Have a great day.